The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the ECAT staff or board of directors.
Hi there, it's Kathy, and welcome to my show, Purpose Driven Aging. Every month we dive into one of the 10 domains of aging, and if you're wondering what they are, it was one of the first videos I did quite a while ago. And each month we dive into a specific segment of that. So today we're going to look in a way at services and supports, but more importantly, we're going to look at the bigger picture. We're talking to somebody who's actually going to show us how to navigate around and how to separate, or number one, how to differentiate a professional elder care advisor from all the other aging experts that are out there. Everybody's an expert on aging. That's what I've found lately. And then we're going to get into some lead generators, online searches, and what happens when you put a search term in and what you get back and what to look for. And then we're going to close up with some clear and practical suggestions on how to choose a competent and compatible advisor. So to help us with that today, I would like to welcome Daniela Masters. Daniela is the owner and the founder of Aging Well Advocates. Aging Well Advocates is a life care management practice, and Daniela will explain what that is. She's a master's level clinical social worker and certified care manager. She has over 27 years of healthcare experience with older adults and aging families and everyone associated with them, providers, families, individuals. Her expertise stems from her mission to provide a more personal touch with helping seniors and their families navigate the complex challenges, and they are complex, of growing older. So welcome.
Thank you so much for having me, Kathy.
You're welcome, Daniela. So I thought we'd start with, there's so much noise, as I mentioned, around aging, expert, everyone who knows everything there is to know about aging. So can you tell us a little bit about the types of people are out there and how you differentiate yourself as a professional advisor from some of the other experts?
There are so many different people in this aging space, as you said, right? Anywhere from home care providers, clinicians, move managers. It's really difficult to figure out what everyone's little niche is, shall we say. Mm-hmm. I think it's important to really look at their websites. What are they offering? What are their backgrounds? Mm-hmm. How much experience do they have in that area? And what is the scope of that experience?
So let me ask you a question. So say I'm a person who, my father or my mother is showing signs of memory loss and is living at home and has lived in that home for a long, long time and is comfortable there. Yeah. And I don't know what's going on. And yet, maybe I think I need home care. Maybe I'm told I need to move to assisted living and sell the house. Maybe I'm told I need to update my will. And there's all these suggestions coming at me from people who know well their particular niche. So how does, the types, what you would do or what an aging care manager, maybe you could tell us a little bit about aging care managers and how they differentiate using that example.
Yes, that's a great example. And that's one that we see all the time. So as an aging life care manager, our role is to look at the entire picture. I think that's what differentiates us a lot from all of these other specialists in aging. I feel like a lot of people have sections of the pie, whereas an aging life care manager will come in to the client's home with the family present. Usually that is what I like to do anyways, and really evaluate all of those aspects. And touch on all of those aspects. And not everyone needs assistance with every one of those pieces. However, most people do need, if not assistance, they need education. education on each of those aspects.
And how would you advise someone that's dealing with someone, say, with memory loss? Where would you start? What would you start with when you entered that home?
I would start with building a relationship with the client, because that's the most important thing, in my opinion. Relationship with the client as well as the family, but really getting to know the client in a very casual way by asking just some little questions about their life, what they like, what their day looks like, and then we often have them either give us a tour of the house so that we can really watch how their functionality is as well, without
like how they walk and
them.
How they, if they're tripping, if there's anything in the house that may be hazardous.
That's right.
Yeah.
That's right. So we specifically ask them to show us around to see, what are they using? Are they using the furniture? Are they using a device to walk? Are there rugs all over? Is there clutter that could cause a safety issue? So that's kind of one component of the assessment. During that in-person assessment, we really try not to get into financials at that point, because that's a very uncomfortable place for the client. And the most important thing is making the client and the family comfortable at that point. Usually there will be conversations with the family afterwards or prior to the actual assessment, because as you know, that financial piece is very important in terms of coming up with the appropriate plan for
In
that
the financial,
individual.
you mean, what legal stuff that's been done?
Correct.
And what the combination is, if it's a blended marriage,
right.
second, third marriage, or even the insurances that may
Yes.
kick in. So
All
different
of the above.
Medicare, secondary payers, long-term
care,
all of that.
yes.
And that's critical. So how about, your pricing, or we were talking earlier and you were mentioning that you'd go and do a consult versus an evaluation versus, a placement. There are different terms that we use in the industry. And this is sometimes where families jump into, and then we come in and you're like, oh, and you have to backtrack. So can you talk a little about that?
Honestly, if I had my way, I think most families I think it would be very beneficial to have even a 1 or 2 time consultation with an aging life care manager, so that they know, okay, here are the things that we have put in place, here are the things that need to be put in place, and can start looking at, based on the client's functional capacity, cognitive capacity, diagnosis history, medication history, all these pieces
medical
come
problems.
together. And medical problems. You can you start building that case, and you start building like a trajectory of what things may look like down the road.
And that's what people want.
And that's what
That's
people
what they
need.
look for. Yes, exactly. Yeah.
Because then, if that crisis should happen, we have a plan in place. And it may not be 100% plan in place, but we've already started the discussion. So we know, and if there's any background stuff that needs to be taken care of, hopefully that stuff can be all set.
So you take all those pieces of that puzzle and you put it together that makes sense for that particular family or that particular person.
Exactly.
Yeah. So could you take just a couple of minutes and describe what an aging life care? When I started out, I was a geriatric care manager. Then I went to aging life care professional, and I retired from that business a few years ago. But Daniela is very active. So can you explain what an aging life care manager actually does?
So we have an amazing association, the Aging Life Care Association, and you are credentialed through them based on your years of experience, your certifications that you have. So they have an advanced level aging life care manager, professional level, and then an associate level.
And they describe what all that is on their website, right?
It's described on the website as to what it is. I tend to advise individuals when they call just to ask questions to look for somebody that is an advanced clinician. This is someone that holds a care management certification. This is someone that has been in the field, either in a nursing field, social work. There are many professionals that can be
like
aging,
physical therapists,
occupational
gerontologists,
therapists. Absolutely. You really want to look at the profession, the clinical experience that comes along with it.
And there is a website, aginglifecare.org, and you can actually find a local aging life care professional in your zip code. And so if you were to put in Easton 02356, you'd be able to actually find people who service in the order that Danielle just described.
That's right.
From your advanced to your professional, along with all their credentials, and it links you right over to their website. So that's excellent, thank you. One of the things I wanted to talk about today that we all get caught up in is doing online searches when we're panicking. You know, we're either trying to find a doctor, a service, a professional. At the time, we're in the middle of a crisis. And I'm sure you've worked with a lot of people who've used these online searches. And can you offer any suggestions on what to do when you sit in front of a computer and start to type in, you know, say my father just had a stroke, he's in rehab, and now he's coming home. And what's my first thing? They gave me a list of home care companies, and I don't know what to do. I don't, who's good, bad, and not so good, and how much does it cost, and does Medicare cover that?
It's so overwhelming. It's so overwhelming, honestly. And I really feel for the families, because typically they are in a crisis state at that time.
Yeah.
Right? Because you don't generally just go looking for this information
No.
if you don't need it.
Yes.
So they're in a crisis state. So emotions are heightened already. Anxiety is heightened. And then you put this search in and you get
Millions.
15 different, you know, even just 15 to begin with, to have to, if you are someone that is, this is not your field of knowledge, right? There are very, very intelligent people in this world.
Oh, yeah.
You know, everyone has their different skill set. But this is a very specific skill set. And if you are not knowledgeable in it, don't have some of that, this can just be incredibly overwhelming. Because how do you differentiate? How do you differentiate?
You know, as an example, in that thing, I'm online and I'm looking it up, and I may have home health care, and I think home health care is going to provide 24/7 for my relative, or I may have a physical therapist that comes in, but only comes in twice a week, and then I'm expected to do all the other stuff. I don't know what Medicare pays for. What if I'm Medicaid eligible? How does that work? How do I work with the ASAPs? How do I know which providers are good quality providers? Can you talk a little bit about that? Because information is well available online, but how do you distill it down for your particular situation?
Again, you want to look at credentialing. Regardless what industry you're working with, you want to look at credentialing. You want to look at some of those testimonials that are on their sites to see if they resonate with you. I think one of the most important things that I try to tell people, especially when they're looking for an aging life care manager, I do recommend that they speak to at least two. And the reason I do that is because you have to click with this person, right? Especially an aging life care manager.
And that's an important piece.
It is an important piece. This is someone that, you know, even if it's just a one-time consultation, if you are on the phone with someone and you are getting that funny feeling in your stomach that this is not feeling right, it's not right for you. And that's okay. That's okay. There are different personalities, there are different, you know, skill sets out there. And I do encourage people, it's really important to get a connection.
Internally. And how do you, you know, if say I'm looking for home care, it's a common search term.
Yeah.
How do I know which of the home care agencies are good? If I'm not working with someone like you, there isn't a way, or is there?
It's really hard.
Yeah.
It's really hard. I think word of mouth right? Is I hear that a lot. You know, oh, well, my friend used this agency and they had a good experience. So that's great.
Yeah.
But you want to look at, okay, well, what is the turnover in that agency? Do you have are all of the caregivers your caregivers, or are you calling in staff people to fill things?
Yeah.
I think one of the biggest things that my clients want to know is there going to be consistency?
Consistency, absolutely.
Is there going to be consistency with a caregiver? Because someone with some cognitive deficits, having a different caregiver coming in every day is simply, it's a disservice to that client.
And it's confusing. And sometimes it can set people
terribly
back.
Confusing.
Because as you mentioned, building that relationship when you first walk through the door for yourself and for anybody who's providing a service is key. You know, you have to sit and spend some time just getting to know who the people are.
And as you know, we're having worked in this field, aging life care managers do develop relationships with some of these home care companies so that we have a contact person when we are overseeing the case and making sure that the requirements that we want the caregiver to be doing on a daily basis. And I try to make the requirements very, very specific, even breaking them down to the day, like Mondays, grocery shopping and meal prep. You know what I mean? So
that it's structure, that consistency.
Structure, consistency.
Exactly.
So that we're overseeing that. And if there's a problem anywhere along the way, I have a contact person that I'm going to call immediately and say, this is not okay.
Absolutely. And one other thing on the online things that has come up is that you fill in some stuff. You know, they'll ask you to put in your name and your email or click on a link or something, and then you find yourself inundated.
Yes.
Inundated. And it's not necessarily by the providers themselves, but they could be lead generators. So I'll go, with a Place for Mom. You know, you put it in there, they are not a provider. They contract with various providers and they're paid by those providers. So it's important for your own privacy to know where to look. And don't put in your information because you will get inundated.
You will.
Which kind of leads us to the next section where we're looking at, okay, we've talked about what's ideal, what's real. We've all been in this situation, and if you have not, you will. You know, I had an experience with a family member over almost a 2-year period, but pretty intensely over the past year. And I can tell you, if I didn't know, I'm like, my goodness, you know, you can just see the overwhelm with people that have no clue how disruptive and chaotic and disjointed everything is. And it's not about the people.
No.
There are excellent clinicians, there are excellent professionals working within these broken systems. And the benefit that someone like Daniela brings is the fact that you know where the broken pieces are, and you know how to work around, and you know how to help people avoid some of the heartache. So if I were to select a guide, let's go through some of the things in detail a little bit about what to look for. The first one you mentioned was industry knowledge. So industry knowledge, can you talk a little bit about what kind of industry knowledge is good when you're working with older folks?
Well, I feel you want to see someone that's had years of experience working with this population. And it can be in various ways. It can be nursing, gerontology, physical therapy, but it's really important that they have a working knowledge of the geriatric population and the issues that come up with those.
Like clinical, functional, cognitive?
Yes, yeah.
And how important is insurance knowledge?
It is quite important as well, because you really need to know what everyone does think that Medicare is going to cover everything. And that is unfortunately very untrue. So you need to know exactly what Medicare covers, how you can appeal the process when it's not covering what you're looking for, and what are some other options that you can look at. For instance, Medicaid, right? Are you Medicaid eligible? What does that mean? What do we need to do to help you become Medicaid eligible.
And also long-term care insurance.
And also
working through
long-term
those
care
products, and if somebody wants to file a claim and what
they're
that
all
process.
different.
Yes.
They're all different
Yeah.
with their criteria.
Yeah.
But it is incredibly important, especially with long-term care insurance. And they can make it very difficult for you to file a claim and get the benefit that you have been paying for all these years.
Oh, yeah. And what are your thoughts on, the references? If somebody were to call to hire you and ask for references, do you expect that at this point, right?
Yeah, absolutely.
You're not taken
Happy.
aback
No.
if somebody, okay.
No, absolutely not. We try to, if someone asks for that, we try to give them at least 2 different people to speak to. There are a number of testimonials on the site, again, that they can look at.
And how important is it to have a kind of a robust network of assisted living facilities or home care companies or adult day health? A lot of the services that we would use, and to know the people behind those. You touched on that a little.
Incredibly important.
So it's
right?
something aging life care professionals know.
Absolutely.
Have a robust network in areas, because you service a certain area, right?
Yes.
How does that work?
It's incredibly important to have those connections because, as I said, if things aren't going the way that the family wants in any of these agencies or locations, having the aging life care manager have that connection to say, we need to have a conversation. Things are not going the way we need them to go in a very
amicable, collaborative.
Yes.
Yeah. And you can do that because sometimes things happen. Sometimes there's, it's really nobody's fault, just not a good fit.
Right.
And, then you have an alternative because the goal is to make the elder and the family content and happy and receive a quality service.
That's the priority.
So, and how long does it take, you've been in this field a while, like to build those networks and sustain those networks? That's a lot of work, isn't it?
It's a lot of work. It's a lot of work. People change constantly in this field. They go from one community to another. So that's kind of a nice thing that you're able to kind of maintain some of those relationships. But it's a really important aspect for your client to advocate so you have their back.
Exactly.
And that's, I think that one of the most important things that an aging life care manager that people need to understand is that the aging life care manager works for you.
Yes.
No one else. So you are the primary person to be advocating for. And if things are not going the way you want, we need to make sure that they are.
And you bring up a really good point that I wanted to touch on is payment for services, because I see a lot, and I've talked to many people, as you probably have, that go for, if it's free, it's for me. And, and I'm not putting down the service in the right context, but when somebody's lost and chaotic and in the middle of something, you need someone who's knowledgeable and understanding. And there are a lot of new services that have erupted, I should say, over the past 5 to 6 years, maybe even a little bit longer. And one of the things I've always advised is if you're not paying somebody yourself, how are they paid? So, well, the Bristol Elder and Old Colony Elder Services are funded by state money and federal money. That's how they're paid. So that's why you're not probably paying. So some of the others are paid for by the facilities that this individual guide may refer you to. So I see a potential conflict of interest with this kind of model, but that's my opinion. And I'm not asking for, unless you want to give your opinion on that, but one of the key things is to know that a lot of professionals work for an organization or somebody else, so that's their first loyalty.
Yes.
The aging life care professional is different because
we work for you.
Yes.
We work for you. Unfortunately, our services are not covered by Medicare or Medicaid. Some long-term care insurance policies do have a caveat that cover a certain amount of time or up to a certain amount of money for a care manager, but that's few and far between, unfortunately. So we are a private pay service.
And without getting into the specifics of amounts of money, because I know everyone sets their own prices, what are some of the service types that are offered? Like you had mentioned earlier when we were talking, an initial consult, a full assessment evaluation,
Right.
a visit. Can you talk a little bit about those different types of services?
Absolutely, absolutely. So again, every company kind of does their own thing, so it's a little bit different. We at Aging Well Advocates do offer consultation services. So, well, we always offer a free 30-minute phone call. So anyone can call at any time with questions, and we will offer you a free 30-minute call with myself. I'm the one that takes those calls.
Okay.
Where they tell us a little bit about their situation, we tell them a little bit about our services, and we see if this is going to potentially be a match.
Yeah.
But then from there, we can say, okay, it sounds like you and your siblings have a lot of questions and varied questions.
Yeah.
So maybe before we even get the client involved, maybe we should just have a one-time consultation,
Yeah.
either via Zoom, in person, or through a conference call. So that is one option. Then we move into the assessment phase. So if they decide to move forward with our services, we move into that assessment phase where we go and we meet the client in their environment and really do a thorough review
Of like the clinical and the long-term
legal,
care and the function
all
and
of
the
it.
legal.
Yeah,
Yes.
advanced directives, medication, all of that. And then we can be involved as much as the family wants or as little as the family wants. I think that's really important for
I do
people
too.
to know.
Yeah.
Because we are partnered with the family and the client. You are our client. So if you decide, okay, we only need help with these 3 items, I should back up. After we do an assessment,
Okay.
we write up, I like to call it a roadmap of recommendations. So
Okay.
we write up a very thorough list of items that are all set, items that need to be looked at, things they need to consider. We usually include links to if we are recommending any particular
Providers?
equipment
Oh, okay.
or providers or home health aid, home health companies, visiting nurse companies, whatever it is, we provide a very thorough assessment.
Of people you know, because you've developed
Yes.
those networks and relationships. Yeah.
And then we like to give the family a little bit of time to review that information, and then we try to schedule another phone call. And at that point, the family says, okay, we only need you to help us with these 2 tasks. We're going to take care of these tasks.
Perfect.
And that is what we want.
Absolutely.
Right? It's a partnership.
Well, we've gone through a lot, here. And I think that's one of the things that, I've found when I can refer somebody, or what I used to do, is once you sit down, it's kind of like a big sigh. Finally, I have somebody who gets it, that gets my story, whereas before I try to tell my physician and he doesn't get it. Well, he gets what he's supposed to get because that's his narrow track. So what I'd like to do is summarize what we just went through, how to look at a professional guide versus, say, the rest of the pack. No one is an expert on everything. I was never an expert on anything, and Daniela, none of us.
Right.
But we're a generalist. We know a lot about things, especially in the aging field. Also, be cautious online. Be careful what you type in, what you link on. And then finally, with the advice that was just given, reach out and talk to people like Daniela. And I'd like to thank you very much for being here. And I'd like to thank you for tuning in again to Purpose-Driven Aging. This is all about getting older. It's about you. It's about us. As you can tell by me, I'm definitely older. I grew my hair out, 3 years ago. I used to be coloring it for years. So we all want to make a difference in the world, and we all want to age well. And the purpose of this program is to bring you content and information to do that. So until next time, I wish you well, and take care.